No signs of life? Are you sure, Doc? The difficulties with medical diagnosis of death. Hello and welcome to the channel. Just a quick warning before I proceed. The subject of this video is issues surrounding death, which some people may find too morbid for their liking, or may trigger a grief response if you have lost someone dear to you. Please use your own judgment as to whether you want to listen to or watch it. More and more people are reporting incidents involving near-death and out-of-body experiences. No one hears more of these incidents than healthcare professionals, especially intensive care and emergency room healthcare providers and first responders. As a GP, I actually don't hear many of these stories, but occasionally someone stuns me with a fascinating story and I'm left scratching my head as to what to believe. A patient recently told me of her brush with death during a hospital stay, following a minor operation. In her case, the operation went very well and everything was fine according to the report I got. But she told me about an unwitnessed apparent near-death experience which had spooked her. She described being in her room, a side room on the ward. I believe it was a double room, so there was another patient in the room at the time. She told me she was lying on her bed 1 minute, resting, and the next, she found herself levitating. It was so sudden, she didn't know what to think. She had not particularly felt ill prior. She looked down and there was her body lying on the bed. She knew it was her body, but she couldn't understand why she was separated from it. She didn't witness any lights or tunnels or otherworldly beings. She just seemed to hang around literally on the ceiling for a while, and then suddenly she was back in her body. She indicated that it was very peaceful, even though she was confused as to how or why it had happened. She was so afraid of being labeled crazy or a fantasist that she hadn't told anyone else, not even her own family. She only told me about it because she wondered if there was a medical explanation that I could find. I couldn't. It remains a mystery to me. Maybe it is relevant to add that this woman has had many miraculous occurrences in her life. She therefore sees this event as a close encounter with a higher being, even though she did not recall an actual deity of some sort during the incident. I shall discuss my take on near-death and out-of-body experiences in a future video. But what if what the patient is describing is not only a near-death experience, but, according to their medical notes at least, an actual death? The next story is more dramatic and is more in line with the topic of this video. This woman had a catastrophic internal hemorrhage during a cesarean section for a twin birth, which went wrong over 40 years ago in a third world country. A resuscitation attempt was unsuccessful and she was pronounced dead. After several days, she woke up in her coffin in full view of family and friends on the day of her planned funeral or burial. In the time she was reported dead, she came into contact with God and spent time in a place not of this world that she called heaven. One of her twins did not survive the birth. She saw the child in the otherworldly realm during the time she was pronounced dead. Now, this woman's hospital notes confirm her death, in inverted commas, and attempted burial. Now, what do I make of this? To me, at best, this is a near-death experience, but in addition, we, in my opinion, unfortunately have a misdiagnosis of death. I think there has only been one case of true resurrection in the history of humankind, and that was Jesus. Any other diagnosis of death must be a misdiagnosis, right? Well, not exactly. Right at the end of this video, I shall explain why this assertion of mine is actually wrong. Believe you me, it's quite a minefield. In this tragic case in Brazil, on the screen right now, which took place in 2018, the patient was actually buried alive and sadly subsequently lost her life. Residents in the neighborhood of the cemetery heard her cries from underground, and there were scratches on the inside of her coffin, and the nails on the coffin had been loosened as she tried to fight her way out. By the time she was pulled out from the ground, it was too late. She had sadly passed. Now, this is a tragic story. I find this topic rather pertinent and scary. It should be the easiest thing in the world to certify a death, but it turns out, in the same way we can misdiagnose illness, we can sadly misdiagnose death also. Let me explain why this can happen. Thankfully, it is rare, but it can happen. Whether in the hospital setting or out of hospital, there are 4 criteria to establish that someone has died. I quickly summarize these. Number 1, there are no heart sounds, and this is confirmed with not hearing a heartbeat on listening with a stethoscope. There is no pulse, and this usually means no central pulse, meaning the absence of a pulse in the neck region or in the groin region. Basically, the carotid artery and the femoral artery, respectively, are silent, non-pulsatile. Now, there are many conditions that can cause a peripheral pulse, like the pulse in your wrist area, to be absent when there is in fact a pulse centrally. So we need to be sure that even the central pulse is no longer there in order to certify death correctly. There are no breath sounds. Ideally, one has to, again, listen to the lungs with a stethoscope. In addition, one has to check for the absence of chest movement. With an adequate bright light, there is no pupillary response. In normal condition, when a bright light is shone in the eye, the black spot in the middle of the colored part of the eye, called the pupil, should get smaller or constrict. And by the same token, when it gets dark, this pupillary reaction, as we call it, is the opposite. So the pupil gets larger or it dilates. It's quite easy to do this test on yourself. Just turn off the light in the room at night and you will feel your pupil dilate immediately. So, in response to a bright light, when death has occurred, there is no response. The pupils are fixed and dilated. All 4 criteria must be tested for a full minute at least. Some say even 2 minutes. I personally always do 2 minutes, just to be sure. This is a diagnosis you don't want to get wrong. It's the difference between rest in peace, and scratches in the inside of a coffin, as per our story from Brazil. Now, it's important to note that the context also counts. The preliminary to this diagnosis of death, according to the criteria I have just mentioned, is what we call general external examination of the body. This is where we try to determine the possible cause of death. Is there a knife in the back of the body? Here comes another warning if you are squeamish. Please skip the next 30 seconds or so of the video, if that's the case. You wouldn't believe the kinds of things that we confront when we go to a residence to certify death. You find all sorts of things. Is it a case of decapitation? In which case, you don't even need to feel for a pulse. You just need to establish that the head and the body come from the same person. I had to do just that in my most gruesome death certification to date. On one snowy night spent on a train track in the company of the police in a tragic case of deliberate suicide by train collision in a young woman. Very sad story of depression for years, in which there ostensibly was no way out for this poor young lady. But, and this is a big but, there are other criteria for death in complex in-hospital deaths, especially in the context of organ donation and intensive care deaths, in particular where legal issues prevail. These criteria are termed brain or neurological death. Now, the history behind this is quite interesting. If you can stomach it, read this 16-page document from the World Health Organization headquarters in Geneva, Switzerland, which is, of course, the country in which I live and work. This document is basically a white paper on death and a guidance for doctors to be able to tell if someone has truly died. Yes, it is that complicated that a committee of experts in multiple medical specialties had to meet to agree on how to diagnose death. You see, with high technology in medicine comes high confusion with respect to end-of-life issues. The same applies to beginning-of-life issues, by the way, with embryo research, stem cells, and IVF techniques. But I digress. If a patient is in a severe brain damage situation due to a massive trauma, for example, a train or car accident, or a blow to the head, and they end up in intensive care on life support machines, basically machines for breathing, for keeping their blood vessels going and their heart going, in what we call circulatory support, and they remain in a coma, at what point do you know if they have passed away? You know that if you take away the machines, they will die. But taking away the machines in an otherwise previously fit and healthy individual is called euthanasia. You see the problem? So we need to know if they are cardiorespiratorily dead, so are their heart and lungs dead, as well as are they brain dead. But there is always a but in this complex topic. As the Geneva document explains, there are numerous ways of dying, but just one way to be dead. Yes, these are the exact words in the document. Confused? So am I. Now, this document goes on to explain further that cardiorespiratory death and brain death are not to be seen as two different deaths, but these must somehow be seen as a unifying unit in the assessment of death in a person who has had a catastrophic brain injury. And importantly, before someone can be declared truly dead, for want of a better description, in the context of a brain injury, the death certification must be done by at least two doctors independently of each other. An unspecified time period must be allowed to pass between brain death tests, and many other conditions must be excluded. For example, their body temperature must be higher than 32 degrees centigrade. Hence the well-known adage, at least amongst first responders and resuscitation medics, you are not dead until you are warm and dead, because temperature simulates death. In winter drowning incidents, when the body is pulled out of icy water, they all appear dead. You can only tell if the patient is really dead only when you warm up the body and there are no signs of life. The majority, however, suddenly wake up when warmed up. It is literally that, death warmed up. I had plenty of such experiences when I worked in emergency medicine in 2 coastal areas in the UK. It's fascinating stuff, if a bit morbid. So, to summarize this little part, you're basically never cold and dead, because cold can make you seem dead, if you see what I mean. To compound the issue, sometimes when death is properly confirmed, there remain still some false signs of life. One of them, a particularly harrowing one for relatives, in the context of long-term illnesses like cancer, is what we call agonal breathing, where the dead person appears to be breathing, albeit with long gaps in between breaths. It is distressing because it gives false hope. In patients with electronic medical devices like pacemakers and implantable defibrillators, sometimes these continue to show spikes on their heart monitors long after they have passed. But these are by no means a true electrical activity of the heart, of course. It is just that, electrical spikes that are not indicative of any sign of life. But this is not easy, trying to explain this to a grieving relative who, quite understandably, is clinging to hope. For the above reasons, most doctors, including yours truly, certifying death in a hospital setting will wait a little while, a few minutes or hours, and go back and re-certify the death after electrical monitors and support devices have been removed and agonal breathing, if present, has ceased and the body temperature starts to drop. And sometimes even rigor mortis, the contraction of the muscles of the body, is there. This way, we are sure that we have correctly pronounced death. Another good reason to wait, in order to avoid a catastrophic story like the ones we have discussed above, is the phenomenon of Lazarus Syndrome. This is a little-known phenomenon, even amongst doctors. Lazarus Syndrome should scare doctors and relatives of the dying, actually. Let's just say it's the kind of thing that puts a spanner in the works in the domain of death certification. If you are Christian, then you will of course know the story of Lazarus, the man who was resurrected by Jesus at the request of his 2 grieving sisters. Lazarus Syndrome, or the Lazarus heart, is also known as autoresuscitation after failed cardiopulmonary resuscitation, so heart and lung resuscitation. And it is the spontaneous reset of heart function after a failed attempt at resuscitation. Basically, it's nothing short of a miraculous resurrection after the patient has been pronounced dead. There are at least 30 reported cases of Lazarus Syndrome worldwide, and that's just the cases documented in the medical literature. Not making excuses for my colleagues, doctors, but do you see how it could seem that forces are colluding against a poor doctor or a poor medical team to work against them in trying to certify a death? Can Lazarus Syndrome explain the 2 cases above where death was pronounced, but there was somehow proof of life thereafter? Does Lazarus Syndrome account for the reported sightings of scratches in the inside of coffins when bodies are exhumed for various reasons? What I find absolutely mind-boggling is that in various cultures around the world and throughout the ages, deliberate so-called premature burials took place. Yes, I mean intentional burying of live persons were done as a form of punishment for various crimes such as sodomy, being gay, rape, infanticide, murder, bestiality, theft, and fornication, including breaking of the lifelong chastity vow by vestal virgins, who were female high priestesses in ancient Rome. Incredible cruelty. It is distressing enough to lose a loved one. What no grieving relative needs is the added psychological trauma of uncertainty as to whether their loved one is truly gone or not. The memory of that is forever. Have you heard of Lazarus Syndrome or know of any such cases? If it's not too painful for you, can you share it with us? What is the message behind this video? It's simply to alert you to the idea that doctors are not infallible, In all humility, there is no sure thing diagnosis. Never was. Sometimes, even in something as simple as declaring death, we may have difficulty. It's not to scare you. My goal, as ever, is just to impart information, to share with you what I know, so that you are better informed, better equipped, better forearmed in your journey through medical illnesses, surgical illnesses, or any other issues to do with your health. Do you have other questions on this topic or any other medical issue for that matter? Don't hesitate to ask a doc.